Hi friends, once again welcome back to the Nurse channel. As you all know, we have started our preparation for the AIIMS NORCET Nursing Officer examination, and we know that the other exams like ESIC, SCTIMST and the JIPMER exams are also in the queue. So this is the fourth set of questions what we are going to explain today, and I request everyone who are watching this video to watch the video till the end without skipping, because whatever explanation I am giving for each questions is very important. Okay, same like the questions, that explanations are also very important, and I am assuring you that you will get a bunch of information from each questions. So the 15 questions what I am going to explain today, kindly watch without skipping the video. And one more request, whoever watching this video for the first time and who are not yet subscribed our channel, kindly subscribe this channel and support us, and kindly share about this channel to your nursing friends and make use of it. Okay, so without losing time, we will move on to the first question. The first questions in the AIIMS NORCET series, there is a fourth set of questions, so we will see the questions.
So straight away, the first question in our series. So here comes the first question in our series. The first question for you is it is from the pediatrics. So the question is, rooting reflex is also called as. So question is very simple. Rooting reflex is also called as dash, and the options for you are option number A, frontal release reflex, option number B, Moro reflex, option number C, parachute reflex, and option number D, Sturtle reflex. So what is the answer? Rooting reflex is also called as. So the answer is option number A, frontal release reflex. Okay, so why it is known as frontal release reflex, that we will see in the explanation, and we will see the other reflexes also. Okay, so this is the picture of the rooting reflex. Okay, so the rooting reflex, it is an innate means by birth response of the head due to the stimulation of the face, mouth or cheek by touching or stroking, and the head is turned towards the side of the stimulus. Okay, so we can see in the picture that when the examiner is stimulating one side of the cheek or the mouth, the head, the mouth and the face is turned towards that side of the mouth, and this is an innate response. Okay, and it is a brainstem mediated primitive motor reflex. Okay, so that is the important thing. It is a brainstem mediated primitive motor reflex, and that's why it is called as the frontal release reflex. Okay, it is known as the frontal release reflex. So this is the picture of the rooting reflex. So we will see the other options also. Another one option was parachute reflex. Okay, so this is the picture of the parachute reflex. So this reflex also appears at about 8 months of the life. Okay, and it never disappears. Okay, so it is elicited by positioning the infant in the prone position in mid-air head first. So the response of the infant is to extend the arms and spread the fingers. You can see that the arms are extended and the fingers are spread to protect the head. Okay, so it is the normal response to protect the head from falling by extending the arms and fanning of the fingers. Okay, we can see the fingers are spread. Okay, so this is known as a parachute reflex, and it appears at about 8 months. Okay, so this is another information. Now the another option was regarding the Moro reflex. So in Moro reflex, the infant will be can be seen like this. So the Moro reflex is a normal reflex of an infant when the infant is startled or feels like they are falling. And what is happening is extended arms and legs. So three things we have to remember in Moro reflex. First one is extended arms and legs. See, the arms and the legs are extended here, and then rapidly brings the arms together. So after that, immediately the arms will be get together to the body, and the child may cry. Okay, so these are the three things you have to remember in Moro reflex. The baby will extend the arms and the legs in the initial phase, and then they will bring close to the body, and the crying baby may cry. Okay, so that is the Moro reflex. Okay. So I think with a single question, from the first single question, you are getting a bunch of knowledge. And one more reflex was there, that is a Sturtle reflex. So the Moro reflex is often called as a Sturtle reflex, and only one difference is that unlike the Sturtle reflex, the Moro reflex does not decrease with repeated stimulation. That means if you are doing repeatedly, the Moro reflex does not decrease, but the Sturtle reflex will be continued, will be persistent. Okay, so that is the difference between the Moro reflex and the Sturtle reflex. Okay, so some newborn reflexes, I think it is clear for you from the first question. So now we will move on to the second question in our series. So the second question we can see in the screen right now, and it is regarding the stool characteristics of a disease. And the question is, currant jelly-like stool can be seen in which disease condition? So the question is very direct and it's very clear. Currant jelly-like stool can be seen in which disease condition? And the options for you are, the first option is typhoid. The second option is obstructive jaundice. The third option is ulcerative colitis. And the final option is intersusception. So there is a peculiarity for the options I have given. So all these conditions you can have one or the other type of stool characteristics can be seen. Okay. So currant jelly-like stool can be seen in which condition? That is the question for you. And you know that the answer of this question is intersusception. Okay. So we will see in each condition what I have mentioned here, what is the characteristics of the stool and why. Okay, so there is a small explanation for everything. So typhoid, you can know, you know that diarrhea is characterized by liquid stool. In typhoid the diarrhea will be there and it is characterized by liquid stool and containing large quantities of leukocytes and proteins, often green in color. So what is the peculiarity? Three things you have to remember in typhoid stool. That diarrhea will be there, so that is a liquid stool. Then there will be large quantities of leukocytes and proteins, and it is green in color. Okay, so that is the point from typhoid. Now the second option was the obstructive jaundice. So what is happening in obstructive jaundice? In obstructive jaundice there is an obstruction that prevents the bile to be excreted into the intestine, and as a result the stool color will be pale or clay colored stool. Okay, so pale or clay colored stool can be seen in obstructive jaundice. Okay. Then another option was, the third option was ulcerative colitis. Ulcerative colitis. So bright red, pink, maroon or sometimes even black stools because of the bleeding ulcers. Okay, because of bleeding there will be bright red, pink, maroon or sometimes even black can be seen in ulcerative colitis. And our answer for the question, that is intersusception. So what is intersusception? So in intersusception what is happening is the stool will be mixed with the blood and mucus and sometimes referred to as currant jelly like stool. Okay, there will be currant jelly like stool because of its appearance. Okay, so intersusception, you know that is a telescoping of the bowel, and as a result the blood will be mixed with the mucus and as a result it will look like currant jelly stool. Okay, so the second question is very important and you are getting stool characteristics of 4 diseases. Okay, so I think that question also is clear for you. Now we will move on to the third question. It is from the OBG. Question is, softening in the midline of the uterus anteriorly at the junction of the uterus and cervix is called as. Softening in the midline of the uterus anteriorly at the junction of the uterus and the cervix is termed as. So the options for you are Hegar's sign, option number B Chadwick's sign, option number C Leading's sign, and the final option number D Goodell's sign. So you know that the probable sign of the pregnancy, all those things. So answer this question. Softening in the midline of the uterus anteriorly at the junction of the uterus and cervix. So the option number C Leading's sign is the answer for this question. So we will have a brief explanation of this question. So what is a Leading's sign? Leading's sign is a clinical sign of pregnancy in which there is a softening in the midline of the uterus anteriorly at the junction of the uterus and the cervix. Okay, it will be at the junction of cervix and the uterus, and it can be seen in the anterior part, and it can be elicited during the 6 weeks of gestation. Okay, so other signs you know, but still I will explain about the Hegar's sign. Hegar's sign is the compressibility and softening of the cervical isthmus, that is the portion of the cervix between the uterus and the vaginal portion of the cervix. Okay, so compressibility and softening of the cervical isthmus is the Hegar's sign, and it can be elicited during the 6 to 12 weeks of gestation. And the another sign was the Chadwick sign and the Goodell sign. Chadwick sign, it is the bluish discoloration of the cervix and vagina. Bluish discoloration of cervix and vagina is the Chadwick sign, and Goodell sign is the softening of the cervix at around 6 to 8 weeks of the gestation. So that is known as the Goodell sign. Okay, so 4 signs you have learned from this question: Hegar's sign, Chadwick sign, Goodell sign, and Leading's sign. Okay. I think this question also is, I think it was very helpful for you. Now we will move on to the fourth question in our series, and this is regarding a solution. A solution of potassium iodide with iodine in water is named as. So what is the solution called? Question is, a solution of potassium iodide with iodine in water is termed as. The option number A Ringer solution, option number B Lugols solution, option number C Benedict solution, and option number D Fehling solution. So you may feel this question is a little tough, but this is also very important. Okay, So if you don't know the answer, just apply the process of elimination and you can eliminate some of the options from here and you can find out the result. So obviously the answer for this question is option number B, that is a Lugols solution. Okay, so we will see what is a Lugols solution and what is the importance in the medicine. So a solution composed of iodine and potassium iodide, which can be used as a reagent and antiseptic with potential use in the cancer diagnosis. Okay. So the cancer diagnosis is the thing why I have included this question in our session, because SCT we can expect more questions from the oncology, and this solution is also known as the aqueous iodine, and it is a strong iodine solution. Okay, so that is the Lugols solution. Cancer diagnosis can be used. Okay. So the other options, the Benedict's reagent, you know that, and the Benedict's reagent is a chemical reagent and it's a complex mixture of sodium carbonate, sodium citrate, copper to sulfate pentahydrate. Okay, and this test use the reagent are called as the Benedict's test. Okay. Benedict's test and Benedict reagent, you know, and the another option was the Fehling solution. So what is a Fehling solution? It is a chemical reagent which is used to differentiate between water soluble carbohydrate and ketone functional groups, and it can use as a test for both reducing sugars and non-reducing sugars. Okay, so it is also a solution which is used, which is a chemical reagent. Okay, Fehling solution. Okay, so I think from this question you are getting some information regarding the Benedict solution, Lugols solution, Fehling solution. Okay. Ringer lactate, obviously you know what is that. Okay, now we will move on to the fifth question from our series, and the question is from the nutrition and is a very simple, very tricky question. Which among the following vitamin is eliminated via urine? Okay. Which among the following vitamin is eliminated via urine? And the options for you are option number A, vitamin D, option number B, vitamin C, option number C, vitamin K, and option number D, vitamin A. So what is the answer? Which among the following vitamin is eliminated via urine, and why? So obviously the answer for this question is option number B, that is vitamin C. Why? So we know that the vitamins are broadly classified into two, as water soluble vitamins and fat soluble vitamins. So you know that vitamin B and C are water soluble vitamins, so that's why they may excrete in urine by humans. Okay, so that is the answer for the question. It's a simple question. So moving on to the next question in our series. So here comes the next question, and the question is, what temperature should platelets be stored? Okay, so the question is, platelets can be stored at what temperature? And the options for you are option number A, 6 degrees Celsius, option number B, 2 degrees Celsius, option number C, 22 degrees Celsius, and option number D, 2 to 6 degrees Celsius. So what is the optimum temperature for storing platelet? So the answer is option number C, 22 degrees Celsius. That means it's in room temperature. So we will have an explanation. Platelets are stored at room temperature, that is 22 degrees Celsius, which is the ideal storing temperature determined so far. Okay, so at room temperature, the platelet concentrations remain viable only for 5 to 7 days. Okay, so it can be stored up to 5 to 7 days in room temperature, which is the ideal storing temperature for the platelets. Okay, so the other things, so as per the standard guidelines, the storage temperature for the red blood cells is between 2 to 6 degrees Celsius. Okay, 2 to 6 degrees Celsius is the temperature for red blood cells, and the platelets and leukocytes, what we have explained now, that is 20 degrees to 24 degrees, that is in the room temperature, and for the plasma products at minus 18 degrees Celsius. Okay, so these are the temperature requirements for the storage of blood and blood products. Okay, so that also I think it was very informative question for you. Now we will move on to the next question, that is a picture based question, and the question is here, identify the traction. I have shown in the screen right now. So what is the traction? Identify the traction. So the options are, the first one is Buck's traction, option number B, Russel traction, option number C, Bryan's traction, and option number D, Dunlop traction. So what is the answer? So what is this picture? So see the kit itself, we can answer this question. So the answer for this question is option number C, that is Bryan's traction. Okay, Bryan's traction. Okay, so we will see each traction what it is. So Bryan's traction, what we have shown in the picture, is mainly used in the young children who have fractures of the femur. So that's why in the question I have given a hint, it can be used only for the young children and for the fracture femur or congenital abnormalities of the hip. Okay, so both the patient's limbs are suspended in the air. Okay, the upper limbs will be suspended in the air vertically at a 90-degree angle from the hip and knees, and the knees are slightly flexed. So that is a Bryan's traction for congenital abnormalities of the hip and fracture femur for young children. Okay, I think that Bryan's traction is understood for you. Now the another option was the Buck's traction, and this is the picture of the Buck's traction, and it is a longitudinal skin traction applied to the extremity in one direction with a single pulley, okay, and keeping the leg in the extended position without hip flexion. Okay, so hip flexion won't be happening here, and the legs will be completely extended, and it is a single pulley skin traction, that is known as the Buck's traction. You can see here, okay. Legs are completely extended. Now the another option was the Russel traction. So what is a Russel traction? This is a picture of the Russel traction, and it is a form of traction which is used to align a fractured femur. This is also for the femoral fracture, and the lower leg is supported in a sling. You can see that the lower leg, it is supported in a sling just below the knee, and pulling forces are exerted upwards. You can see a pulling force here, and a pulling force is there which is exerted upwards, and the longitudinally by means of the pulleys and weights. Okay, so here it will be a sling will be attached, and it will be giving pressure upwards, and as I said in the earlier, it is supported by a sling. Okay, so this is known as the Russel traction, and it is a treatment option for femur fracture. Okay, fracture. And another option was the Dunlop traction. So you can see the picture of the Dunlop traction in the screen right now, and this is the traction placed along the axis of the forearm. See, it is for the axis of the forearm as well as at the right angles of the humerus. Okay, this is the humerus by means of a broad sling. You can see a broad sling placed around the upper arm. Okay, it is placed around the upper arm. Okay, so this is the different types of tractions, and you have seen the pictures also. So now moving on to the 8th question in our series. So 8th question is here on the screen now. So the question is, inflammation and thrombosis of small arteries and veins in hand and feet is termed as. Question is, inflammation and thrombosis of small arteries and veins in hand and feet is termed as. So the options for you are, the first one is the Raynaud's phenomenon, then option number B, Buerger's disease, option number C, hand, foot, mouth syndrome, and the final option number D, systemic lupus erythematosus. So what is the answer for the question? Inflammation and thrombosis of small arteries and veins in the hands and feet. So obviously the answer is option number B, that is a Buerger's disease. Okay, Buerger's disease is the answer. So we will have a small explanation regarding the question. So thromboangiitis obliterans, also known as the Buerger's disease, is a recurring progressive inflammation and thrombosis of small and medium arteries and veins of the hands and feet. Okay, so thromboangiitis obliterans is otherwise known as the Buerger's disease. Okay, so we will see the other options also. The one of the other options were Raynaud's syndrome. So what is Raynaud's syndrome, otherwise known as the Raynaud's phenomena? It is a medical condition in which the spasm of the small arteries, not the veins, spasm of the small arteries causes the episodes of reduced blood flow to the end arterioles. Okay, so the difference is like the Raynaud's symptoms, that small arteries are getting affected, and when it is exposed to extreme cold condition and all, the spasm of the small arteries will happen, and as a result there will be the reduced blood flow to the end arterioles. But in the thromboangiitis obliterans, what is happening is both the arteries and the veins are getting affected of the hands and the feet, and smoking is one of the main reasons for the development of thromboangiitis obliterans. Then the other option was HFMD, that is a hand, foot and mouth disease. Okay, hand, foot and mouth disease. Okay, it is a common infection caused by a group of viruses known as the enteroviruses. Okay, and it typically begins with a fever and feeling generally unwell, then which is followed by a day or two later by flat discolored spots or bumps that may blister on the hands, feet and mouth, and occasionally buttocks and the groin. Okay, so that's why it is known as the hand, foot and mouth syndrome. So it will be present on the hands, feet and mouth, and occasionally on the buttocks region. Okay, so sometimes it is called as a tomato fever also. Okay, so this is the hand, foot, mouth disease. And one more option was there, that is SLE, systemic lupus erythematosus, and it is an autoimmune disease in which the immune system attacks its own tissues, causing widespread inflammation and tissue damage in the affected organs. Okay, so I am not going in depth about the SLE and all, so I just explained the options what I have given. Okay, now we will move on to the 9th question in our series, and the question is on the screen. Question is, NDPS Act 1985 is an act specifically related to dash. So NDPS, so for what this act was made? So the options are option number A, drugs and pharmaceuticals, option number B, diagnostics and sampling, option number C, narcotics and antipsychotics, then option number D, demography and population. So this NDPS Act is related to which of the options I have given? So the answer is option number C, that is narcotics and psychotics. Okay, narcotics and psychotics. So we will have a look on this Narcotics, Drugs and Psychotropic Substances Act. Okay, that is NDPS, Narcotic Drugs and Psychotropic Substances Act 1985. It is an act of the Parliament of India that prohibits a person the production, manufacturing, cultivation, possession, sale, purchasing, transport, storage and or consumption of any narcotic drug or psychotropic substances. Okay, so this is the NDPS Act. Okay, so NDPS Act is for the narcotic drugs and psychotropic substances related thing. Okay, so I think in hospitals and all, in NABH accredited hospitals and all, you can see based on these acts, some protocols, we have to keep the narcotics and the antipsychotics, psychotropic drugs in double locked this one cupboard. Okay, so that's all regarding the NDPS Act. Now we will move on to the next question, that is the 10th question. The question is, it's a simple direct question. The most abundant protein present in the human body is. So the question is, the most abundant protein present in the human body is. So the options for you are option number A, actin, option B, collagen, option C, rubisco, and option D, glutamine. So what is the answer? Which is the most abundant protein in a human body? So the answer is collagen. Collagen is the most abundant protein in the human body. Then what about this rubisco? We'll see it in the explanation. So collagen is account for the about 30% of the total protein concentration in the human body, and it is a key constituent of all of the connective tissues in our body. Okay, so collagen, in that the type 1 collagen is the most abundant protein in a human body. Then which is the most abundant protein in the world, in the earth? Okay, that is rubisco. So rubisco is thought to be the most abundant protein in the world, since it is present in every plant that undergoes photosynthesis and molecular synthesis through the Calvin cycle. Okay, this Calvin cycle and all you know in the biology classes. So rubisco is thought to be the most abundant protein in the world. Okay, so in the human body, collagen; in the world, that is rubisco. Okay, so two information you are getting out of this question. Now we will move on to the 11th question in our series, and the question is very simple. Which disease is known as the disease of kings? Okay, so which disease is known as the disease of kings? And the options for you are option number A, tuberculosis, option number B, hemophilia, option number C, gout, and option number D, diabetes. So which disease is known as the disease of kings? Not king of diseases. The question should be very careful. Disease of kings. So what is the answer? So gout is considered to be as the disease of kings. Why? So gout has long been known as the disease of the kings, and gout is also called as the king of arthritic diseases because the pain of an acute gout attack is so severe it often leads to a visit to the emergency department. That strain will be there for the gout. That is, it's known as the king of arthritic disease and also known as the disease of kings, because in the olden days that affluent families got this disease because of their daily habits. Okay, because of their routines. So that's why it was termed as the disease of kings. Okay, then we know that the TB was considered as the king of diseases. Okay, TB was considered as the king of diseases, and yeah, hemophilia, sometimes called as the royal disease, like that. Okay, so just an additional information for you from this question. So I think that also is clear for you now. Now we will move on to the 12th question in our series, and the question is, adipose tissue and mesenchymal stem cells are found in dash. So the question is, adipose tissue and mesenchymal stem cells are found in dash, and the options are red bone marrow, option B, yellow bone marrow, option C, both red and yellow bone marrow, and option D, none of this. So where you can find adipose tissue and mesenchymal cells? Fat. So the answer is option number B, that is the yellow bone marrow. Okay, so we know that we have two types of bone marrows, that is red and yellow. So the red bone marrow contains the blood stem cells that can become red blood cells, white blood cells, or the platelets. Okay, that you know very well. So what about this yellow bone marrow? Yellow bone marrow is made up mostly of fat, and it contains the stem cells that can become cartilage, fat, bone cells, etc. Okay, so just remember that we have two types of bone marrows, yellow and red. Red for the blood cells and yellow for the fat. Okay, clear? Now we will move on to, that was, I think it was a very informative and a very important question. Now we will move on to the 13th question, and the question is, which of the following drugs would be ordered to improve the platelet count in idiopathic thrombocytopenic purpura? So we have told that we will be including application level questions also. So this is one among that. So the question is, which of the following drugs would be ordered to improve the platelet count in idiopathic thrombocytic purpura? So first of all, you have to think in mind what is idiopathic thrombocytic purpura. Then you can answer this question very easily, and the options are, the first option is acetyl salicylic acid, the second option is corticosteroids, then the third option is methotrexate, and the final option is vitamin K. So through the process of elimination also you can come to the answer of this question. So what is the answer? So the answer is option number B, that is corticosteroids. Okay, so we will have a small explanation regarding this question. Idiopathic thrombocytic purpura, otherwise known as the ITP, may occur when the immune system mistakenly attacks the platelets. Okay, it's an autoimmune disease, so steroids play a vital role. So corticosteroid therapy can decrease the antibody production and phagocytosis of the antibody coated platelets, retaining more functioning platelets. Okay, so that is a reason why we are giving corticosteroids in idiopathic thrombocytic purpura, because it is an autoimmune disease. Okay, so the other options in that vitamin K, one option I have given. So you may be confused with that option, because vitamin K, what is the purpose of vitamin K? Vitamin K is used to treat an excessive anticoagulate state from the warfarin overload. So warfarin antidote is a vitamin K. Okay, so don't be confused with this. Okay, so that's all regarding the 13th question. Now we will move on to the second last question in our series, and the question is, a patient with leukemia has neutropenia. Okay, so the question, you should be very clear. A patient with leukemia has neutropenia. So which of the following functions must be frequently assessed? Okay, so this is also another application level question. A patient with leukemia has neutropenia, and which of the following functions must be frequently assessed? So think about the neutropenia and answer the question, and your options are, first one is the blood pressure, then B, bowel sounds, C, heart sounds, and D, breath sounds. So which one should be assessed for a patient with neutropenia diagnosed to have leukemia? So what is the answer? So obviously the answer is option number D, that is breath sounds. Why? We know that the neutropenia occurs when the number of neutrophils in the blood falls below the normal. Then there will be a higher risk of getting infections. Okay, so among the infections, pneumonia is the most common. Both viral and fungal pneumonia is the most common cause of death in clients with neutropenia. So frequent assessment of the respiratory rate and breath sounds is required. Okay, so this is another application level question. So you should understand that neutropenia can result in higher risk for getting an infection, and among these infections the pneumonia is the most common. So we have to assess for the breath sounds, respiratory rate, etc. That is respiratory system assessment we have to do for patients with neutropenia. Okay, clear? Now we will move on to the last question in our series, the last one, and the question is, the average length of time from HIV infection to the development of AIDS is. So HIV infection to the development of AIDS. Okay, so the options are, option number A, less than 5 years, option number B, 5 to 7 years, option number C, 10 years, and option number D, more than 10 years. So the length of the time from HIV infection to the development of AIDS. So this is a disease, that is AIDS, no? And HIV is a virus. So after getting the virus inside the body, how much time it will take to develop it as AIDS? That is the question. So what is the answer? Answer is option number C, that is 10 years. It will take 10 years. So untreated HIV typically turns into AIDS in about 8 to 10 years. Okay, so with that question we are coming to the end of this session, and again the 15 question what we have explained is very important. And once again I am telling you, if you have any doubts upon these 15 questions or any doubts regarding the explanation of these questions, you are free to ask in the comment section. And once again thank you all for watching the video without skipping, and stay tuned, we will be uploading the next video very shortly. Till that time, see you, bye.